Welcome to the HiArc EHR system. In this module, we will discuss e-prescription. HiArc's e-prescription module supports all RxNorm codes, is highly flexible, and has many built-in features to make the e-prescription process easy and effective for your provider. Many of our individual features can be easily customized, which makes our system adaptable to any specific type of practice. Let's take a look. As soon as the problems are recorded, the e-prescription button at the top of the left-hand navigation menu will be enabled. Next, click on Options in the right top-hand corner of the page, and it will show all the additional options available to that user, including password change, formulary configuration, user and practice preferences, etc. Click on Preferences Practice. This is where all the practice-specific settings are done. Here you can notice the settings for drug-drug interactions as well as drug-allergy interactions. Let's change the drug-drug interaction from contraindicated only to all interactions. Then we click on Make these changes at the bottom of the page to save. We'll now go back to the Prescribe page by clicking on the Prescribe link at the top of the screen. Before prescribing, we need to add any allergies that the patient has. In this case, our patient is allergic to penicillin. So we'll add that information. Once the allergy information is added, we'll go to prescribe the medication. We'll add a medication for Synthroid 112 milligrams. Type in the first few letters of the name of the drug and hit Find. It will list all the drugs that match our criteria, and we can select the one we want from the list. Since this drug has already been prescribed by the doctor in the past, the dose and frequency are already populated. Then to place our order, we click on Continue. Go back to the top of the page and click on the Prescribe link again to prescribe another drug. This time we'll prescribe Tums Calcium for Bone Life 300 milligrams. You can see that the system will give an alert in red. This is a drug interaction alert. If the drug must be prescribed, select one of the reasons from the drop-down menu and click on Prescribe Anyway. Here, we'll just cancel. Let's now go back to the Options page by clicking the Options link at the top right-hand corner, and we'll click again on Preferences Practice to change the settings for the drug-drug interaction from all interactions to contraindicated only, and then we'll save our changes. Go back to the Prescribe page and let's try again to prescribe the same drug, Tums Calcium for Bone Life 300 milligrams. You'll notice this time there is no alert message because we changed the severity settings. Now let's complete the prescription. The dose and frequency are automatically populated. Click on Continue. The system will give a dose check alert because the frequency prescribed in this case is greater than the usual frequency. We'll go ahead and prescribe this medicine. Once again, we'll go back to the Options page and go to Preferences, Practice. Here, we'll check that the drug allergy interaction is set to all warnings, and then click on Make these changes to save. Go back again to the Prescribe page, and now we'll prescribe cephalexin for our patient. Let's select cephalexin 500 milligrams capsule. The system will show an allergy alert in red. To go ahead with this prescription, choose a justification from the drop-down menu and click Prescribe Anyway. The details of the prescription will be shown. After confirming, click on Prescribe. The review prescription will show. Now we click on OK to complete the prescription. On the Prescribe page, the pending prescriptions will be listed separately. If any prescription needs to be deleted, click on the Delete button next to that prescription and it will be removed from the list. Let's now add one more prescription. We'll add Diabeta. While prescribing, we select Diabeta 2.5 milligrams. The strength can be corrected from the next screen if necessary. Select 5 milligrams from the drop-down and click Continue to prescribe. The prescription for Diabeta 5 milligrams can now be seen. Click on OK. We now see our 3 pending prescriptions, Tums Calcium, Cephalexin 500 milligrams, and Diabeta 5 milligrams. The pending prescriptions can also be viewed by clicking on Pending Rx at the top of the page. The number shown in parentheses is the number of prescriptions that are pending. In order for the prescription to be completed, it must be signed off and approved by a provider. Every provider will be assigned a signature password to use when completing prescriptions. Once the prescription is approved and signed off, a notification will appear saying that the prescriptions have been signed and sent. The medications will also be listed under the patient's medications list. We hope you enjoyed this demonstration video. Please contact us with any questions or feedback by calling our customer support hotline at 315-362-9800 or visit our website www.HiArcEHR.com. Thank you for watching this demonstration of the HiArc EHR system.